Hey there, welcome back to How to Medicate and welcome to this new video on anxiety disorders. This video will cover all the ins and outs. We will cover the different types of anxiety disorders, how to prevent them and how to treat them. So stick around for that video. As you can expect, this video is part of a video series on mental health problems. And for those of you interested, check out that playlist in the description after watching this video, of course. Now let me quickly introduce myself. My name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate myself, as well as you, my viewers, because I believe that medically educated people make healthier decisions, which is the whole point of this channel and this video. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and if you're looking for medical advice, you guessed it, always ask your own doctor. And now let's get started. So as promised, I will start by explaining exactly what anxiety disorders are. Although here it is important to mention that it's totally normal to feel a short temporary moment of anxiousness during a test or during an important moment at your work. However, those dealing with anxiety disorders experience much more than this temporary fear. When Googling, you find the following definitions. Anxiety disorders are a cluster of mental disorders which can be characterized by significant and sometimes uncontrollable feelings of anxiousness and fear. And these can have a huge impact on a person's personal, social and occupational functioning. There are several types of anxiety disorders, like a generalized anxiety disorder. This is characterized by a persistent and excessive worry and fear about everyday things. A panic disorder, which may cause a panic attack when stress levels get too high. A person may start to hyperventilate, sweat, and may want to avoid or run out of the situation they're in. Then there is social anxiety disorder. This may cause obsessive worrying about social interactions with other people. There usually is a fear for being judged, embarrassed, or ridiculed. There are specific fears, also called phobias, where a person can have a very intense fear for a certain object or activity, like fear of heights or fear of flying. Another common anxiety disorder is agoraphobia. This is an intense fear of entering open or crowded places, a fear for leaving one's home, or a fear of being in places which it's difficult to escape from. And lastly, there is a medication-induced anxiety disorder. This can be caused by the use or the withdrawal of several drugs, illegal drugs, or several medications. In addition, it's important to mention that there are several risk factors which might increase your chances on developing an anxiety disorder. Experiencing trauma, severe stress, having a personality disorder or depression, having a combination of mental health disorders, having a close relative with anxiety disorder, and excessive use of drugs or alcohol. Which brings us to the prevalence of anxiety disorder. Anxiety disorders are one of the most common mental health illnesses in the world, affecting about 40 million adults in the United States alone. And according to recent research, about 33.7% of all people will be affected by an anxiety disorder at one point in their lives. Which finally brings us to the treatment options for anxiety disorders. The usual treatment consists out of three factors: lifestyle interventions, the usage of drugs and medication, and lastly, psychotherapy. For each and every person, this treatment plan is different. Most people may benefit from a combination of these treatment types, and it can be some trial and error before you discover which treatment options work best for you. Therefore, it's always important to start with the basics. It's important to take good care of yourself, physically but also mentally. This means change your clothes at least a few times a day, shower regularly, maintain a tidy home and workplace, and keep a structured sleeping schedule. Try to wake up and go to bed at fixed times. Aim for 7 to 9 hours of sleep per night and try to avoid sleeping during the day. In addition, it's helpful to plan your days. This will make it easier to structure them and have a purposeful day. When making your schedule, make sure to add some activities outside of your house. Sometimes a small walk can be enough. Next up, follow a healthy diet. Eat enough vegetables and vitamins and drink about 1.5 to 2 liters of water each day. Lastly, try to stay in touch with your family, friends and loved ones. Call them up or visit them. This can have a huge impact on your mental well-being. If you try to implement these lifestyle interventions but they were insufficient, your doctor might prescribe you psychotherapy. This can be followed individually, in a group or with your family. Your doctor might start off with psychoeducation, providing you with insights on your anxiety disorder and certain provoking and supporting factors. Furthermore, your doctor might encourage you to structure and plan your days, set goals, and provide you with certain exercises to overcome your complaints. In addition, cognitive behavioral therapy might be useful. This therapy aims to help you identify and understand your behavior, thoughts, and negative beliefs. After which, it tries to help you replacing them by healthy and positive ones. Furthermore, you could also benefit from several stress management interventions. Or take a look at time management training, occupational training, and light therapy. Lastly, your doctor might combine these treatment options with medication, depending on your underlying symptoms, the severity of your symptoms, and co-occurring mental health conditions. Commonly, your doctor might prescribe anti-anxiety medication, mood stabilizers, or antidepressants. For more information on any of these, check out my playlist in the description. Which brings us to the end of this video. I hope you learned a lot, and I hope you know now what an anxiety disorder is and what a proper treatment plan should look like. If you have any questions, let me know in the comment section and I will do my best to answer all of your questions. And for those of you that want to keep on learning or that want to know some specific in-depth information on any of the mentioned drugs, check out the playlist in the description. All that rests me is to thank my sponsors on Patreon. Thank you, Sebastian, who's an Invested Tea supporter, and thank all of you for watching. If you did learn something or if you did enjoy the video, please leave a like. This will help out the channel tremendously, and consider subscribing. You will never miss such an awesome medical video ever again, and you will help me reach my goal of 100,000 subscribers before the end of this year. For those of you that can't get enough, also check out my Instagram account @HowToMedicate. I'm posting there a few times a week. Thank you all for watching, and as always, I will see you next week with a new video. Bye bye.